Okay, it's time to look at the heart, and we spend quite a bit of effort on the heart because it's important and it's a big deal. So first off, I want to show you, this is from the anatomy lab. Sorry, it's the Institute of Human Anatomy, and it's cool because they show actual cadavers. Now I'm starting halfway in, just because the earlier part talks about the chest cavity, but isn't related to the heart.
Smack dab in the middle, we have this gigantic superstructure. And I say superstructure because there's a bunch of smaller structures inside of it called the mediastinum. And obviously the thing that's probably going to catch your eye first that's inside of the mediastinum is the fact that the heart is inside of it. Although it's surrounded in this really cool connective tissue layer called the pericardium, but the heart is going to be just right here. And then also inside of this mediastinum, we have this thing. It's kind of fun to poke. This is the ascending aorta. This is the largest blood vessel in the human body. And it's going to, but also behind it is another vessel called the pulmonary trunk. And both the ascending aorta and the pulmonary trunk are going to be sending blood away from the heart. And then you can also see all this yellowy tissue. This is fat. It's called the epicardial fat, and it's completely normal, but this is going to reside on top of the heart. Now, normally, there would also be another gland right.
That showed the pericardium of the heart, or the heart sac, in a cadaver. Now, there is a live one, a real one. And you can see the great vessels on top. Those are the atrium, and then the ventricles are on the bottom. So the atrium are right up here. They look like little flaps of ears, what he's poking right now. They're not very muscular. That's the atrium right there. That's the chamber that receives the blood. Here you can see the inside of the ventricles and the valves. So what they're poking through is the material that holds the valves. Now we're looking into the mitral valve, and the mitral valve is one of the big areas there. So if you look in the inside of the heart, there's the mitral valve, and you can see the flaps at the top, and the flaps help make the muscle or the valve more secure. You can also see the musculature of the ventricles on the side of it, right there. Right here, this is the ventricular wall, very muscular. And these are what are called the chordae tendineae. And this is the big aorta, large. Look at how muscular it is. And that's the main vessel that takes the blood away from the heart. Then just a quick look at the outside to see the a little bit of fat and the arteries on the outside. It's the arteries on the outside that feed blood to the heart itself. And then on the back side of the heart, you'll see more arteries. Okay, that video just gave you a quick introduction to what a real heart looks like, because sometimes when we see it on paper, we just think it is this massive two-dimensional thing, but it's only the size of the fist, and really it only pumps about 70 milliliters at a time, which is about three tablespoons, so not a large amount. Okay, let's look at the textbook and label the parts that we need to look at. When we look at the structure of the heart, we talk about the outside wall. Now we have, so here's the inside here, and then the outside is this way. So when we look at it, it's very muscular, and you have the pericardium, which is the muscular sac around, the protective covering around the heart. Then you have the myocardium. Myo means muscle. And then inside you have this smooth endocardium. And the endocardium is needed to be smooth so that it will not cause any friction against the blood. And also this is a beautiful example of epithelial cells that we've talked about. The myocardium is that special cardiac muscle that we looked at. And then the pericardium is around the outside. Next, we're going to look at the heart itself, and I want you to pay attention to the chambers. The atrium are the chambers on top, and they're not very muscular. They're the ones that kind of look like little dog ears on the actual heart. And then the ventricles are the bottom chamber, and they're more muscular. And then we have valves to prevent backflow. So let's have a look at the textbook. And here we have, see, this doesn't really look like the one we saw. Here are atrium. Notice that the right's on the side as if it's the person on the your patient. And then here is the left. So you have the atrium on the top, the ventricles on the bottom, atrium on the top, ventricles on the bottom. The right side receives blood from the body. The left side receives blood from the lungs. So when the blood comes in, it's going to come in the superior vena cava and the inferior vena cava if it's coming from the bottom. Then it goes through this valve called the tricuspid valve, and that's because it looks like it has three parts to it. The blood then goes into the ventricles contract, and the blood will go out of the pulmonary artery to the lungs. In the lungs, it gets oxygenated. It comes back on the pulmonary vein and goes into the left atrium to collect it. Then it goes through what's called the mitral valve into the left ventricle. Now, the valves between the atrium and the ventricular have specific names, the tricuspid and the mitral, also sometimes called the bicuspid. But they are classified together as the atrioventricular valves because they're between the atrium and the ventricles. Then there is a second set of valves which go to the great vessels, and they look like moons, so they're called semilunar. This is the pulmonary valve that goes to the pulmonary artery and the aortic valve that goes to the aorta. Now make sure you know those parts that we mentioned, the upper chambers, the atrium, the lower chambers are the ventricles, and the four valves. We're looking at Blackboard now. To give you more introduction to the heart, here is a video which shows the pumping of the heart quite nicely. Read the section, which I just did, and then here's some fun songs to help you remember your heart parts. Then to help drill it in, I have two quizzes for you, and you just click on the link. It will take you to the quiz. Do the quiz as many times as you wish, and then once you're done, do a screen grab and submit it to me. And then I divide the number by 5 to get you your mark for that one. Okay, so that is the rest of the heart parts.